Setting up your meeting for Facebook Live. You're gonna let me know, Zach?
I don't know what I got to do with the
Okay, you're live.
We're live, guys. Okay, sorry for the technical difficulties, but we're live on Facebook now. I want to welcome everyone. I'm State Senator Brad Hoylman, here with my colleague, Assemblywoman Linda B. Rosenthal. Say hello, Linda.
Hey, everybody.
And we're here tonight.
Hi, everyone. Can you see me? Here I am.
Yes. And we're here tonight in our virtual town hall about COVID-19. We know a lot of New Yorkers, constituents of ours, are extremely concerned about the specifics around this pandemic. And we're so lucky to be joined here with three specialists in infectious diseases who are going to help answer us some of the questions about COVID-19 and practical ones, as well as scientific and detailed ones that I think you'll want to know more about. I wanted to introduce my guests here tonight with the Assemblywoman. The first is Paul Binoche, PhD. He's the professor investigator at Howard Hughes Medical Institute at Rockefeller University. His research topics include cell biology, immunology, virology, microbiology, and the mechanisms of human disease. Dr. Binoche studies the biology and evolution of retroviruses, including HIV-1, and the genetics of host virus interactions. Welcome, Paul.
Glad to be with you.
And sitting next to him, who happens to be his spouse, is Theodora Hatzianu. Thank you. PhD. She's a research associate professor at also the Rockefeller University in the Laboratory of Retrobiology. Her accomplishments include being part of the first research team to ever develop an HIV-1 based virus that is able to cause AIDS-like disease in a non-hominid, helping us further understand HIV/AIDS. Welcome, Theodora. Glad you're here.
Happy to be here. Thank you.
And then finally is Vincent Raccaniello. Vincent is the Higgins Professor in the Department of Microbiology and Immunology at Columbia University's College of Physicians and Surgeons. He's done laboratory research on viruses for more than 40 years, starting with his PhD program at CUNY and continuing to this day. He's studied common viruses, including influenza and polio. We'll have to learn what a common virus is, because polio doesn't sound like it's a common virus, but I'm sure there's a reason for that. Linda, do you want to take it from here?
Yes.
Okay.
Oops.
Oh, I think we may have lost Linda in the process. I'm sure she'll be back on in a second to join us, but wanted to basically ask our guests here the first question. Which is, I think, something a lot of New Yorkers want to know. What exactly is COVID-19? How does it differ from other diseases we've heard of before, like SARS and H1N1 and other coronaviruses? I understand that a lot of young children have coronaviruses. How is COVID-19 different?
Well, COVID-19 is a disease caused by SARS-CoV-2, a brand new coronavirus that just emerged in December last year. And COVID stands for coronavirus infectious disease. 19 is in honor of 2019. And it is very similar to the original SARS, which emerged in 2003 and caused respiratory illness for about 9 months. But it's very different from influenza. I think the only thing it has in common is that it can be spread by respiratory droplets produced by talking and sneezing and coughing, and by contamination with mucus. But these are very common. Before these epidemic coronaviruses emerged, we had many other coronaviruses that would cause common colds, very mild infections, and nearly everyone got them. We didn't pay much attention to them because they're not very serious. But starting with SARS in 23, MERS in 2013, and now SARS-CoV-2, now we have these more serious viruses that are causing very serious respiratory infections.
So the 19 is 2019 when it was first discovered.
That's right.
So so while we thought it was first discovered, we heard about it first in January, soon after the new year.
Well, we actually knew about it in December, which is when the Chinese first reported it.
And how is it different from your average coronavirus?
Well, it causes a more serious disease. The average coronaviruses just give you a cold and upper respiratory tract infection that everyone recovers from. And this one, it's a new virus to people. It only came to people at the end of 2019, so no one is immune to it. And in a fraction of infected people, the virus goes down deep into the lung and causes very serious illness, unlike the common cold viruses.
Right.
Yeah.
Linda, do you want to ask a question?
Yes, sorry. Yeah, sorry for, I lost my connection. So thank you, Brad. I'm Assemblymember Linda B. Rosenthal. Thank you to our wonderful guests. It's a time of great trepidation and people really are searching for answers. So thank you so much for being here with your answers. One of my questions is many countries are dealing with COVID-19 and it seems like we've seen different ways to respond. What have we all learned from seeing the different responses from places like China, South Korea, Italy, or Iran, for example?
Well, China, of course, was the first country to see this virus. That's where it emerged. And they were caught unawares. And so it spread extensively in Wuhan and the surrounding province. And they were unable to deal with it. So that had very high mortality rates. It overwhelmed their medical system. But once it spread outside of that area, the other parts of China were able to deal with it. And then as it spread elsewhere, countries like South Korea began in January to make preparations for testing and for hospital capacity. And they have a very low fatality ratio as a result. In contrast, countries like Italy and Iran, which have been unprepared, have many thousands of cases and many thousands of deaths because they don't have the hospital capacity and the infection has spread before they could do anything about it. So the moral is you have to react early and you have to really reduce spread as they did in China. And here in the US, we're just getting started. It could be a little bit too late. We should have started in January, but it's better than nothing, right?
Yeah.
Yes.
Wow. So are you able to understand what we should have been doing in January at this point, or is it even fair to compare our preparation with a country like China?
Oh, I think, look, South Korea took note of it in January. We knew it was happening in January. We decided to ignore it. The CDC wasn't doing any testing, didn't develop a test kit. We should have in January developed a test kit. We should have started expanding hospital capacity because we knew already from the Wuhan experience that hospital beds were going to be an issue. A lot of these people need ICU care, and that's limiting. So we could have been doing all that. And it's only till this week that we're really ramping up the production of diagnostic tests. This is completely unacceptable for this country. We have way better technology than that.
Paul and Theodora, is this just an example of pandemic denial, or what was going on?
So obviously we're not privy to the inner workings of government and the CDC. But Vincent's exactly right. This was sort of something you could see on the horizon approaching. We were all aware as virologists outside government what was happening in Wuhan, and there really was, we think, some falling asleep on the job in terms of keeping an eye on what's going on around the world. Now, obviously, there's a degree of unpredictability in the early stages of epidemics like this. One can't say for sure how this is going to play out, but the usual watch phrase would be to hope for the best and plan for the worst. It's pretty clear we hoped for the best and didn't plan for the worst. And that's how we end up in our current situation.
Well, we should say that
So we might, sorry, go ahead.
the CDC did prepare a test, but the test was not functional, let's put it that way. So they had to stop and start all over again. And that, of course, lost a lot of time. And in places like New York, where the population is so dense, testing is paramount. Otherwise, you have no idea how far the virus spread, what the virus spread in the city is.
So this could be a calamity.
Yes.
It seems that some sectors of people are not listening to what authorities are saying. So perhaps you could explain about social distancing. And does that require that bars and restaurants and senior centers be shut down immediately?
So to be honest, none of us can answer this with certainty, okay? Because again, we are flying blind here. We have no idea how widespread the infection in New York City is. We don't know. The number of tests are probably way underrepresentative of what the real number of infected people is. So while it's very difficult to say with certainty, yes, we need to do this now, I think at this stage, where the test capacity is not going to reach what we need anytime soon, the only way to mitigate this disease is to stop everything as much as possible, social distancing as severe as it can be. Otherwise, our hospitals will get overwhelmed and the city is going to stop. So, for example, there was already a case of a fireman being diagnosed positive. They shut down the fire department for a week. They haven't tested the other firemen, which they should.
Just that fire station.
The station,
not
the
whole
fire station,
department.
yes. But imagine this at a much larger scale. Imagine the police stations in New York City having to be shut down. Imagine all the hospitals being so overwhelmed with patients that even people with other diseases or that need different treatment cannot get access to the hospital. It is exactly what you said, potential calamity, disaster.
Yes.
Well,
it makes sense to take precautions now, even though we don't know the full extent of the epidemic currently. We do know that the more we're testing, the more we're finding, and we're in this exponential ramping up phase of the epidemic. Under that situation, it certainly would be my advice that frequenting crowded bars, for example, is a terrible idea.
well, we want to thank you for your outspokenness on shutting the public schools. As you know, today, both the governor and the mayor announced the closure beginning tomorrow. So that's a relief for a lot of parents. I know your parents, as am I. We're getting a lot of good questions from viewers right now. A question from Phyllis. She asked, can the virus live on public benches and newspapers? I know this because we were walking around today and my 9-year-old was asking that very question.
Vincent has the data for that, right?
Yeah, so a study is about to be published where they ask that question: how long does the virus infectivity survive on different surfaces like cardboard and plastic, copper, stainless steel? And the answer is it can survive for at least a couple of hours. It doesn't survive forever. It doesn't survive for a week or a month, but it's measured in hours. So if someone contaminates a surface, you could get infected by touching it. And that's why it's really important in commonly trafficked surfaces that they're cleaned regularly. And even in your home, you should do that. And you should wash your hands frequently because yes, you could acquire infection from a contaminated surface.
Wow.
There is a somewhat important ramification that comes from those observations, and this is at least my opinion, is that sort of cleaning at intervals of, say, 72 hours or so is going to have a fairly minor impact on the rate of transmission from surfaces, because the number of people touching, for example, a pole in a subway car, if you clean that once every 3 days, just imagine the number of different interactions that subway pole has had And you're going to probably interrupt one of very many interactions that various people's hands will have had with that.
Yeah, we keep hearing
So,
about deep cleaning, and I don't think you're fans of that as being a way to prevent the virus's transmission.
So it's good that they are deep cleaning, but bear in mind that as soon as a person comes in and coughs, that's it. You need to deep clean again.
Yeah.
Otherwise, you haven't really destroyed everything, and then the new viruses can get reintroduced to that space. Just because you deep cleaned it doesn't mean it becomes sterile forever.
It's clean until the next person comes along.
So would you say that if someone has to go out, they should wear gloves and not touch their face, as we've been hearing, even though it's quite difficult to stop yourself from touching your face, but wearing gloves and then changing the gloves when you go out again or touch other things sounds like a smart thing to do?
Yes, provided the gloves don't get used so much that hospitals don't have enough to.
Yes. No, like your own personal acrylic gloves,
Yes.
your own winter gloves, for example.
Yes, your own
You can use those.
leather
Yes.
gloves would be fine. Yes.
Yes,
Right,
and
right.
actually, I don't know if this is true of all people, but it's certainly true of myself. When I'm wearing a pair of gloves, I'm very much more conscious of touching
Yes.
my face. I mean, we
Yes.
subconsciously touch our face with our bare hands all the time. It might be simply because I'm trained as a microbiologist, but I don't think it is the case that with gloved hands, I feel somewhat less likely to touch my face.
So would you say that what are there other things we should absolutely not do during this crisis in terms of interactions, going out, etc.?
So I would say there are few things that you absolutely shouldn't do. There's a long list of things that I think you should reduce your activity as much as possible.
Okay.
Just simply to reduce the probability of becoming infected. For example, things like the use of public transport, where you are inevitably brought into contact with large numbers of people. If you have to go to work, you have to go to work, and if public transport is the only way of getting to work, then you absolutely should and must use it. If you are able to choose a time to travel to work that's not during rush hour, sort of spread out the commute, so that you're just reducing the number of people that you interact with. That's a good strategy. Going out to bars and restaurants, I would put that in the luxury category, something that's not really an essential part of your life and something you could.
Should we shut down all bars and restaurants?
I would not be opposed to that.
Yes.
Yeah,
Yes.
I agree.
So another thing is for the people that are now staying at home with kids, no play dates, no going out all together in the park and swings and equipment. No, that's not the reason why we are shutting down the schools. Okay, you have to stay home with your kids by yourself. I'm sorry, it's going to be hard. We know it's for us. It's day one today, and we're already going crazy. But
what can you do? You can take a brisk walk.
You can take a walk, yeah, absolutely, provided that you not go to crowded places. And today we tried to go to the East River Promenade, and at some point it got very crowded because there were a lot of people out there. So we turned around and walked along in the streets where there were less people, and also cautioned the kids not to touch surfaces, not to get too close to other people. And it's things like that that are going to make a difference. And
here's a question from Milla. I think it's for Vincent. What is the general time range of someone being infected from start to finish? And can you get the disease more than once?
Yeah,
Ah,
well, that's-
so good.
yeah, that's a question that many people are asking. So let's talk about the time course. So let's say you get infected, the virus begins to reproduce in you. You could start to see disease symptoms, cough, fever, congestion, anywhere from 1 to 14 days. 14 days is the longest we've seen. The average is 5. So in about 5 days, you're going to start having these symptoms. And it's important to emphasize that 80% of these infections cause mild disease where you wouldn't even seek medical care because you think you have a cold or a flu. And you would recover in a couple of weeks for sure. The only problem is the 20%, which are going to have more severe disease, and a fraction of them will need hospitalization, and a fraction of them will require ICU beds. And that's why we want to keep the numbers of infection down. The other question is really important. I've seen that over and over again. All the news channels, people are asking that. People are asking us, can you get reinfected? So traditionally, when you get a virus infection, influenza, polio, whatever it may be, and you recover, you're then immune to another infection. That's why we have vaccines that mimic that, because they make you resistant to infection. I don't see any reason to believe that SARS-CoV-2 is any different. I think there's some anecdotal indications of people getting reinfected, but I think a fraction of those are probably failed diagnostic tests. So you need 2 consecutive negative nasopharyngeal swab tests before you're released, and you can easily get a false negative. And I think the people aren't really recovered yet, and that's part of the problem there. So until I see those data, I would assume that you're not going to get reinfected.
So maybe just to add to that, what I don't think we can say at this point is over the longer term. So certainly in those first few weeks and months after being infected, then the expectation is that you would be immune to SARS-CoV-2. But I think it's true, Vincent, and you can correct me if I'm wrong, that with the milder coronaviruses that have been with us for a while, it is possible years after an initial infection to become reinfected with those coronaviruses.
Yeah, you can, but then that second infection is typically much milder disease. And that seems to also be the case with MERS coronavirus, where we still have infections in the Middle East. You know, after a year or 2 or so, you can get reinfected, but very mild disease and not the same as the first one. Yeah.
That has profound implications for how this is going to look going forward after we've gotten through this initial crisis.
Meaning it might come back in a different
Yeah.
form?
Yes, but over time, as the population, if this indeed happens, obviously we're speculating here, but over time, if this happens, then we would expect the overall impact on the population to become milder. If you've had this infection once and then acquire it a second time, if in 80% of people it's already a mild infection, you would expect that number to increase.
What about the danger, and I'll turn it over to Linda, but what about the danger of it mutating and returning? That is the flu epidemic of 1918's like worst scenario for us.
No, not going to happen.
Okay.
This is something that everyone's scared of, and there's no evidence that viruses change during the course of an outbreak to get worse. They stay the same. This virus is really good at transmitting among people, and it's good enough. It doesn't need to change.
Yeah. The selection pressures acting on viruses are pressures that enable them to transmit more efficiently between people. They're not selection pressures that are expected to make them greater.
First good news I've heard about COVID-19 since this began.
Sorry?
That's the first.
So we have a question from Tay, who's an Upper West Sider. We have a question from Tay, who's an Upper West Sider, and she asks, with all the sanitizing, is there a risk the virus will require an immunity to the sanitizing agent? Sort of like the problem with antibiotics, people, no. That's
No,
not a problem.
No.
Explain how
How
it
the
works.
how do the sanitizers work, and how do the soap and water work? This virus is what we call an envelope virus. So it has a lipid membrane surrounding its genetic material. When you use soap and the alcohol-based sanitizers, you dissolve that membrane. So the virus is no longer infectious. It cannot acquire a resistance to those agents.
Okay, now soap, some people use just, fancy soap that doesn't have antibacterial. That makes no difference?
No difference. As long as you use soap and you wash your hands properly, as all the videos, I'm sure everybody's aware of these videos, the songs, the memes
Yes.
about how to you wash your hands, you will be fine. It doesn't have to be an antibacterial soap.
Great. And another question is, does the warmer weather have any effect?
Good question.
So we don't know yet. Obviously, this is a new virus. It's we're still understanding exactly what its properties are. We do know that at least to some extent, the coronaviruses that have been, the mild coronaviruses that have been circulating in people for some time do have something of a seasonal aspect to them. So it's possible that things will get a little better as the weather warms up, but it's not something that we should be relying on as a given.
Okay.
Well, you've seen some of the outbreaks in warmer climates, but are we seeing it in South America, elsewhere where they're Australia as bad?
Too early to tell, I think.
Yeah.
It's certainly happening.
Maybe Vincent, you could.
I mean, we certainly see cases in warm areas, right? Singapore, even in Africa, Middle East. I think, as Paul said, many respiratory viruses and others are seasonal. Influenza is seasonal. Most of the cases are in winter. However, when you have such little population immunity as we do to this virus, that can override seasonality. And that happened in the 2009 H1N1 influenza pandemic, when that started circulating in a weird time of the spring. So I think that's what's happening here. But as we go through the coming years, I guess it will probably become seasonal, and it will most likely remain as a human virus, and we'll have recurrences over and over. But as Paul said, hopefully it will get milder and milder as time goes on.
So Gabriella has a question that we've been asking in our household. How long can coronavirus survive in the air? And should we be wearing masks?
So that was also this study I mentioned earlier. They measured how long the virus remained infectious in aerosols. In the laboratory, they generated aerosols using a machine, and then they measured, and again, a couple of hours. All right, so it doesn't last forever in aerosols. And the thing is, it's actually not an aerosol. We should call it a droplet, because they're very big droplets that we produce that carry this virus. They fall to the ground within a few feet. So not only do they fall to the ground, but then within a few hours, they're inactive. So that's not an issue. But wearing a face mask is a really good question. The CDC, as you know, has not recommended that people wear face masks. And there are two reasons for that. One is we don't have nearly enough in the US to go around. And that's something we could have been doing back in January, is getting more face masks. We need them for our healthcare personnel to protect them, because if they get infected, then we're in real trouble because there's no one to take care of us. The second is most people don't use them properly, and that they're not useful, because we do know in studies that have been done, face masks can prevent respiratory infections, but only if they're worn properly.
Is it a certain kind of face mask? Could you use a scarf? Could you make your own face mask? Does it have to be the fancy one that has the filter? Do we know?
Well, surgical masks, right? Which just the paper things that you tie around your back, or you loop the elastics around your ears. Those are good. There are others that are better, but those would be adequate. And those are the ones that you get. If you go to a clinic now and you have fever and cough, they will put one on you to protect the healthcare workers. But, if you wrap a scarf around your face, I don't know how much more it's going to protect you, but it's probably going to be better than nothing. And maybe if you pass people on the street, you should just scarf up.
If we saw you on a plane, Vincent, would you be wearing a mask?
Well, you're not going to see me on a plane. I've canceled.
Exactly. Yes.
Don't
Yes.
travel. I was going to go away next week. It's all shot for the rest of the summer. But if I did, yeah, I would wear a face mask.
You won't
Absolutely.
fly under any condition.
Don't fly. No, don't fly.
No.
So the schools seem, they will be shut until April 20th. Do you think, what are the possibilities that they will be shut for the rest of the school year, meaning till the end of June?
Highly likely.
Yes, exactly. I agree. Highly likely.
That does require something of a crystal ball, but and it really the length of time that the schools will need to remain shut and how long we'll have to impose social distancing really does depend in large part how the population responds to this request to implement social distancing. The less prevalent people's actions, or the less responsibly people behave now, the longer we're going to need to have to impose these social distancing measures. As I say, difficult to predict now, but it's not going to be for a very short time, that's for sure.
Agreed.
I think that younger people got the impression that they're immune. And because the initial warnings were seniors, people with underlying health conditions. But would you explain how younger people should not consider themselves immune to this virus?
They're not immune. They will get infected. Maybe a smaller percentage will have severe symptoms, but some of them will have severe symptoms. And some of them will need the same ICU units that if they're completely full by old people, they won't be able to access. So don't think that you are Superman
important.
and that you're not affected. Everyone is affected when the system breaks down.
Yeah. There's really no evidence that there's an age dependence in terms of your ability to acquire and transmit the infection. Very clear evidence of age dependence in the severity of the disease.
Okay, that's good to know. Thank you.
We haven't seen young children or infants being particularly hit hard. Is that correct, and why?
Yeah, that's right.
Yes.
Kids under 9 have not shown serious disease, although they get infected. And I was speaking to a coronavirus expert on Friday, and he said, in those kids, even if they don't have respiratory symptoms, if you look in their lungs, you can still see evidence that the virus is damaging cells. So it's in there. Why the kids are not developing disease is a great question. And people are going to want to know that, right, to try and understand why they're so resistant, and if we can use that to protect other people.
So, and that brings a question from Conrad. He writes in saying he's a male, 72 years old, and healthy. Can you determine what his risk is?
What is healthy also, right?
So I don't have that number.
I can tell you.
What the risk is for someone with those specific. But his age confers some risk.
He's high risk.
His being healthy de-risks him significantly.
But it's high. 70% is, I think it's 4% mortality rate based on the Chinese data. Am I right?
That's correct.
4% for over 70s?
Yes.
Over 80, it's like 14%.
My goodness.
But
And-
again,
all of our colleagues. Sorry, go ahead.
sorry, I was going to say that this depends, I mean, the rates we are quoting depends on an intact healthcare system, right? The death rate right now in Italy is 10% for everybody. Okay, because the system has collapsed. So we are assuming when we're saying these numbers that the persons will be able to get treatment. in time and appropriate treatment.
We should also note that these numbers in terms of what fraction of people who get infected die, they are somewhat fungible at the moment. We'll be able to determine them much more accurately in retrospect when we have an understanding of exactly how many people got infected.
So here's the number: between 70 and 79, based on 45,000 cases in China, you have an 8% case fatality ratio. 8%.
8%. Okay. Higher than I
So
thought.
that was a situation where the healthcare system was severely stretched.
Right.
But there's a much better appreciation of the numbers of people infected.
I think you have to contrast South Korea, where it's less than 1%, because they can take care of everyone who's very sick. You should not die of this disease. Very few people should if you get proper medical care.
You know, there's kind of a Western chauvinism that's been demonstrated by some public officials who say that we're different than China. You know, and unlike some countries, we wash our hands more. Do you think there's any validity to those arguments that we're going to endure this better than some other nations because of those habits?
Absolutely
No.
not.
No, there's really nothing to support that contention whatsoever.
What about the people who get sick during the course of their lives? They have heart attacks, they develop cancer. What about treatment for people like that?
In terms of what?
It sounds like everyone will be busy, all the medical professionals will be so taken up with dealing with people who have this COVID-19. What do you think the prospects are for people who develop, as everyone, as society has, people have developed cancer, people have strokes, people have heart attacks, people have other illnesses that are just common. What are the prospects for them being taken care of during this crisis?
So that'll clearly vary from disease to disease. One could imagine, for example, that a specialist cancer center would likely continue largely as normal. That's not something you can easily convert to a respiratory viral infection treatment center. But it's things like emergency rooms and particularly intensive care capacity going to be stretched. So it's our intensive care capacity in the United States is already well used, right? We don't have a lot of surge capacity, and so you could imagine that basically the complete saturation of that capacity by people who need assistance breathing effectively is going to have knock-on effects to a number of other clinical manifestations.
So I have a question from Daniel. This is a true New Yorker's question. Is takeout okay?
That is how we struggle about this ourselves, actually.
And he also asked, what about food delivery?
Yeah.
So I can say what we've been doing. We have been having food delivered. That does bring you into contact with one person. Okay, that's a lot better than going to a full crowded restaurant. And we take out of an abundance of caution approach. We, for example, clean the exterior of the containers in which the food is delivered. We're virologists. We sort of.
Did you wash your hands? Did you wash your hands?
Of course.
Of course, yes.
Of course. And now
does the virus live on food? If the workers in the restaurant cough on the food, could you contract the virus by eating the food?
So I don't know that that's ever been tested, but my expectation would be yes.
It depends. If it happens before the food is cooked, I would expect the cooking would
Absolutely true.
would get rid of it. So
Yes, cooking certainly will destroy this
yes.
virus.
But if it happens afterwards, and that's why we are so careful about the exterior of the containers, because okay, we are hoping that the people in the kitchens that are cooking the food are already mandated by the city to take certain precautions, right? But the people who handle the packages and they put them together or deliver them are not necessarily keeping the same level of hygiene. But you can get rid of that. You just wipe the outside. So at least that's
Would you wipe a milk carton off before you put it in the refrigerator if you went to the grocery store?
Sorry?
Would you wipe a milk carton off from the grocery store before you
right now I'm wiping everything and I'm washing everything, even bananas and oranges and everything that goes into my house I wash with soap.
Yeah.
What about you, Vincent? Are you a obsessive compulsive wiper of food packaging?
No, what I depend on is washing my hands a lot, right? So if I put a carton of milk in, if I buy a carton of milk and put it in, then I will wash my hands before I do anything else in the house. And I think that can help a lot as well.
Yes, we do that.
Patricia wants to know, what is an appropriate distance from people? Because we've been told 3 feet, we've been told 6 feet. What do you think?
So basically, there's not a bright line between what is safe and what is less safe. Basically, it's a probabilistic function. The further away you are from somebody, less likely you are to experience contact with respiratory droplets as we speak and talk. I think you'd be really quite unlikely to contract infection from somebody who's speaking normally to you at a distance of say 6 feet or so. If they point themselves directly at you and cough in your direction, then that number's going to change. So I think maintaining a healthy distance is a healthy thing to do.
Okay, from what I saw when I went to the drugstore today, people were ignoring all of those rules. Coughing in the air, little kids sprawled on the floor playing with toys, which were then put back on the shelves. I think perhaps, I won't name the store, but I think maybe proprietors need better instruction on what to do. It's not something anyone should take cavalierly.
I agree.
From what you're saying.
That's going to be difficult for each person that has a store to do. So if yes, perhaps for large chain, pharmacies or supermarket that have a lot of employees, but small shops that have smaller shops or shops that don't have so many employees, they cannot put all their customers. So I think and to be honest, I don't know how the city is going to implement this. Yes. Perhaps saying shut down restaurants, bars, and stuff, and places where people can gather will send a stronger message.
Yeah. There's going to be a period of adjustment where societal norms, at least for a while, are going to have to change.
Yes.
And people need to, I think, learn about these measures that we should be taking to essentially to protect each other. And over a time, hopefully not too long a time, we'll see it as sort of a form of etiquette to keep a respectful distance from each other to essentially protect each other.
And here's a question from Tech. I'm sorry. It's not from Tech. It is from Alice. Alice wants to know whether dogs can be infected. Can they transmit the disease through their fur? And the disease came from a small mammal. Do dogs and other small mammals get coronavirus, but it never manifests to our knowledge?
So there are coronaviruses of dogs, actually, but they're different from the ones that infect us. So at the moment, we don't know if SARS-CoV-2 can infect dogs and cats. There is some concern because there are some similarities between us and other animals, which could suggest that this virus would enter animals and establish another reservoir, say in the US. This is a major concern at the moment. We don't know if it's happening, but I would exercise caution even with your pets if you're infected, if you're known to be infected, because we don't want to establish, as you said, it came from a bat, maybe a small mammal, and it's gone into humans now, and humans are effectively spreading it globally. And the last thing we want to do is for it to go back in mammals in another country and remain there forever.
Vincent, what are the actual symptoms that we need to be looking for in ourselves and our family members?
So the main symptoms, the top ones are cough and fever and congestion. And then there are a whole range of others that are less common. Way down on the list, about 4% people get diarrhea, but it's not very high up there. Cough, fever, congestion are the main ones. So the thing is, it's like any other.
Is it a very high fever, or?
It doesn't have to be, but it can be, depends on the person. But, the thing is, at this time of year, if you have cough and fever, you could have any number of respiratory viruses. You could have influenza, you could have common cold. So it's hard to know what it is.
And body aches similar to flu, or?
You can have malaise, you can have muscle aches, loss of appetite, absolutely.
Is it possible that I had a friend who said they had a very intense flu a month ago, and they went into the doctor, they were tested, they came back negative for the flu, but they said they've never had this kind of flu before, this kind of devastating flu. Is it possible that that coronavirus was circulating a month or longer in New York City?
Absolutely. It could have been that. And in fact, many astute physicians notice when people have something that they say, this is the worst flu I ever got. And then they test them and they turn out to have coronavirus. So it's very possible. Yeah.
When, is there any date that it might have been here? When could it have been here earliest in your analysis of
well, we know that the virus was circulating in Washington, the state of Washington, back in January. And I would not be surprised if it were here as well because of the travel routes from China. We have a lot of flights from China, but we just didn't look.
If someone had it and the illness has since disappeared, would there be any way to test to know whether they had it or not?
Yeah, so in a short amount of time, we'll be able to do serum tests to show if people have antibodies to the virus. So if they were infected a month ago or so, we can see evidence of that for a long time, even if the virus is gone.
So Audrey wants to know, if a vaccine is developed, would the goal be to vaccinate everyone? And how far off do you think development of a vaccine is?
So I think, yes, vaccinating large numbers of people would be appropriate. Obviously, if you've already had the infection, then that would be pointless. And by the time a vaccine is developed, large numbers of people will have been infected. We can't know at this point what fraction of the population. As I say, it depends on how people behave. Now, as to how long it's going to take to develop a vaccine, that is a very good and very difficult question. Most optimistically, and I stress this, most optimistically, we're talking probably close to 18 months.
Really?
That is if our first attempts at making such a vaccine actually prove to work. That is by no means guaranteed, and there are some special considerations with this group of viruses that might make vaccine development challenging. So it's not something that we should rely on having anytime soon.
Because I've seen on Facebook and other places where, well, Israel's developed one and other countries have developed one, but even if they have, there's a whole regimen to test it and verify that it actually works, right?
So what they have developed are vaccine candidates, okay?
Okay.
Things that can go forward into testing in animals and humans. And of course, all of these interventions have to be tested for safety and
Yes.
efficacy. The very worst thing you can do is to put a vaccine into people that isn't safe.
Yes.
And the second worst thing you can do is put a vaccine into people that doesn't work. Because in that case, you'd give false security and make the situation worse. So we certainly do have to move urgently, but no less rigorously to develop vaccines against this virus.
So nobody should rely on that happening in the next few months. That's
Nope.
good to know. Thank you.
Definitely not.
Yeah.
Additionally, you have a large number of the population that doesn't believe that vaccines are working and don't
Well-
refuse to take them. So what are you going to do about those? Force vaccinate them?
I suspect
know-
some people might change their mind based on recent events.
Well, last week we were in Albany in session, and the collection of groups that were up there included anti-vaxxers, doctors, nurses, and pharmacists. And I think those are 4 groups that might have very well been exposed. And they traveled throughout the Capitol and the Legislative Office building, and we all had meetings with them, and we were all stuffed into elevators very close to each other. So it's an example of something that's done every day, and you don't realize how dangerous it could be. So people should heed your warnings and other directives that government has given, right?
So as you asked about vaccines and other measures, I want to make something clear. The epidemic is coming, right? We're not going to stop it at this point. What we're trying to do with all these measures is to what we call flatten the curve. So there is, let's say, I don't know, I'm pulling the number out of a hat. 100,000 people are going to require ICU treatment. You do not want 100,000 people descending on the hospitals all at the same time, because then the system will collapse. What you want to do is to make 100 people visit ICU over a long period of time. And the only way we're going to accomplish that is if we keep away from each other and we don't socialize anymore. It's very hard, but it's the only hope we have to get through this at this point.
That's interesting. And I'm interested to know whether the vaccines, let's say the flu vaccine, does it offer us any protection if we've had it? No. What about antiretrovirals? I've heard that there are some antiretrovirals that they're testing to see if it has any efficacy on COVID-19. Any truth to that?
So there's a class of drugs called protease inhibitors that are very effective against HIV. And coronaviruses have proteases. And so there are some experiments and trials going on to see if those drugs do work against the coronavirus. My understanding is that the level of optimism that those trials will prove successful is somewhat low.
Well, you have a population in New York of people on protease inhibitors, right? And one could glean from, I guess, some of the experience of New Yorkers in that regard. A question from Bill and Chelsea, who's asking about the fact that we're running out of hand sanitizers, at least it seems in some stores. Is there a recipe to make your own that you would suggest?
Yes, there is actually. So I've actually made some myself. So what you can find in pharmacies, although even this is proving difficult to find now, are things like rubbing alcohol, isopropanol and ethanol. And the way I made it was to mix that with in a particular ratio, which I'll go into in a second, with after sun treatments that have aloe in, sort of an aloe gel like substance that you put it onto it to soothe your skin after sunburn. If you take the rubbing alcohol and the aloe gel and mix them, so it's mostly alcohol, a bit of aloe gel, you have to keep the alcohol concentration above 60%, okay? That gets you pretty close to what you can buy as hand sanitizer. It's a little more runny. It's not quite as nice as the real hand sanitizer, but what it does is it gets that ethanol onto your hands, but doesn't dry out your skin because you have the after sun mixed in. Now that's a great recipe. Unfortunately,
I think you may have a future in cosmetics or dermatology. What about hydrogen peroxide? What does that do?
Ooh.
So I haven't tested that myself. I would think that would be rather nasty on the
Well,
skin.
I heard a Times reporter say that he sprays it on his laptop to clean it. Is that any?
Hydrogen peroxide?
That would be, I think that would be expected to inactivate the virus. What do you think, Vincent?
Yeah, in fact, that's one of the things they were spraying in some countries.
Oh.
The hydrogen peroxide mix, or bleach. Bleach will also work if you don't mind your clothes being all white, I suppose, because they were spraying that in China as well. Yes, those will both inactivate virus, but as Theodora said, the peroxide and the bleach are going to be pretty rough on your skin. So just use it on surfaces. And your laptop, I'm not sure it's a good idea on the keyboard, right? It's going to destroy it. Maybe the outside.
Would you say that in apartment buildings, the landlord should install a Purell or any other kind of hand sanitizer in the lobby? I've seen some have done it, but certainly most do not have that.
It's funny because that's exactly the discussions we're having with our board right now. What exactly we should supply to the building. So we did supply those sanitizing tissues. So people can use them to open the door handles and all these things. Yeah, we did that. And we did ask our super to clean commonly touched surfaces more frequently. But again, it's you cannot do that every time someone enters and someone leaves the building.
Right. That's right.
So would be a great idea to have hand sanitizers as widely distributed as possible, and clean the doorknobs, elevator buttons, so on and so forth. But there is clearly a huge shortage of hand sanitizer in the city.
I think you know that the governor of New York is having inmates produce 100,000 gallons of sanitizer a week, and so that should be available to us as well.
Yes.
Good.
Yes, I heard that. But yeah. Otherwise, when you get in your house, just wash your hands. Wash your hands as soon as you get into the house.
Yes. And take your shoes off, presumably, right?
Oh, definitely. We do that anyway in New York City.
Yeah, we do. Sometimes I forget, but not anymore. My husband reminds me. Well, I think Linda, I think we've reached the end of our hour. I just wanted to thank Paul, Theodora, and Vincent. This has been a really interesting, informative, in many ways inspiring conversation to know that there are New Yorkers like you working on these issues with such information and personal experience to share with our constituents. I'm just so grateful for your time. And we will make it through together, in part with your guidance and wisdom, helping us navigate this very difficult situation. Right, Linda?
Yes, and I must say that some friends of mine have been texting me that you're also informative and also calming. You're giving it to us straight, and we really appreciate it. There's no political talk and there's no BS. You're actually in the trenches on viruses, and we really appreciate your time and your dedication and your willingness to go this Facebook Live route. Thank you.
Well, you're very welcome.
Our pleasure.
I have enjoyed doing it, and if we can be of help in any way, then we're more than happy to.
Well,
do.
maybe we can think about doing this, Linda, on a regular basis, because
That's good.
I think we've got some weeks and months ahead of us.
Yes, absolutely. Thank you.
Thank you. Thank you so
Thank you.
much.
Thank
Have a
you.
good evening. And let's,
You're welcome.
speaking of politics, maybe we can catch the second hour of the debate.
Yes, that's going on too. That's correct.
Yes. Thank you.
Good night, everyone.
Okay, good night.
Bye.
Bye.